our second speaker series in a 5-part series, and our first on Zoom. So thank you for joining us today. We are really honored to have a wonderful panel of guests to talk about the relationship between healthcare and the workforce, as well as give you valuable information to help manage your business and communicate with your employees. In addition, we want to continue to raise the profile of the work that HCAM is doing in the community. So continue to share some of your concerns for those that are joining us, of your biggest concern regarding the workforce moving forward. So continue to share that in the chat. And we're gonna kick it off by doing a quick introduction for the panelists, who you are, what you do, and how you do it. Just really quickly, we're gonna start with Diana Ellis, who is joining us from Humanim.
Hi, thank you, Tracy, and great to be on the panel. So my name is Diana Ellis, and I'm the Vice President of Strategic Partnerships and Development for Humanim. We're a nonprofit workforce development agency that has been around for almost 50 years. We operate over 35 different programs, mostly throughout Central Maryland, focusing on behavioral health, developmental disabilities, workforce development, and social enterprises.
Thank you, Diana. I know you're freezing but we could hear you. So thank you for that introduction. And I am gonna turn it over to Signe Pringle from the Department of Commerce. Welcome.
Yes, hi everyone. Thanks for having me. I'm Signe Pringle. I'm the Assistant Secretary at Maryland Department of Commerce, and I oversee the Division of Business and Industry Sector Development. And really what we are focusing on and what our mission is to attract, retain, and help companies grow here in our great state of Maryland. So thanks again for having me.
Thank you. We appreciate your time. We know how valuable everyone's time is. So thank you for giving us this hour. I'm gonna turn it over to Mick Arnold, the President and CEO of Arnold Packaging, and love to introduce yourself.
Yeah, good afternoon. My name is Mick Arnold, and thank you for having me. I'm looking forward to discussing some healthcare with you guys today. Arnold Packaging is an 87-year-old manufacturer and distributor of packaging materials. We have about 1,100 customers, generally in the Mid-Atlantic area, that consist of distributors and manufacturers, so we get to see a lot of different businesses in action. We also have an automation division, which we started about 3 years ago, which focuses on using automation tools and tactics to improve productivity for both manufacturers and distributors. And I'm actually coming to you from Southern California today, so we'll be able to sit in.
Thank you, Mick. Is it gorgeous weather?
It is. I can understand why people fall in love with Southern California. Every day is exactly the same, and it's pretty much perfect.
That's beautiful. Well, we did get beautiful weather here today, so.
Good.
I am also gonna turn it over to Bob. Bob, I think you are frozen, but maybe we can hear you. So I'm gonna turn it over to Bob Berry.
I think I am frozen, but I apologize. I don't know how to unfreeze myself. You can hear me all right?
Yeah.
All right, welcome everyone. I look forward to having a discussion today. Again, my name's Bob Berry. I've spent my whole career in the hospitality restaurant space. I began my career with Marriott International. For the past 13 years, I spent as the president and CEO of the Greene Turtle restaurant chain based in Columbia, Maryland. Last May, I stepped down. I'm involved in some small businesses. Today, you'll hear me talk about the hospitality, the food service, restaurant space. They're all one and the same. I'm not trying to confuse you. I'm just going to talk about how this is affected and healthcare comes into play looking forward past COVID-19. So thanks again for having me.
Thank you, everybody. And so we're excited, and thank you for muting your lines. Everybody, all the participants are muted. So if you're not speaking, please stay muted so we can make sure everybody is being heard. So we're going to start with a couple panel questions, and then at the end, we're going to ask some chat questions again. But if people have questions, you can put them in the chat. We'll make sure to try and get some of those things answered. What today is not, I do just want to touch upon from the healthcare perspective. We will not be going into CDC and OSHA guidelines related to PPE and COVID-19. So that is a different topic. We may touch upon that, on how it's impacting the workforce, but we're not going to talk about guidelines related to PPE or those, but I do think it will come up as a generalized topic. So first question for the panelists, and this is not at anyone specifically, so please jump in. What has the impact been to your industry? So this is in a broad perspective, in regard to the workforce and how healthcare has been impacted. The impact to your industry in regard to the workforce and how their healthcare has been impacted.
Trace, I'll kick it off if you want. This is Bob.
Yep.
Sure. Go for it, Bob.
So for the restaurant space, the changes in customers' expectation will open up a number of new positions in the hospitality industry as venues need oversight and staff and quality control. I think what we're going to see in the restaurant space is teaching our staff, your staff, anybody that's in the restaurant or hospitality space about, and I know you just said this, we're not going through that, and I'm not going through the CDC guidelines, but teaching your staff the CDC guidelines, state guidelines, county guidelines, brings up a whole new element to the hospitality industry, mainly to get the knowledge and the training into your team members. So that's going to be the probably biggest impact in our industry, is taking that into the training program that hasn't been in place in the past.
Yeah, and I can speak to manufacturing and distribution. It's very wide ranging. You know, certain manufacturers, I'm sure you've all read about the situations with some of the chicken processing facilities, and it's very specific to the type of manufacturing plant you run. Certain plants are required to have people working closely together. They're either working on equipment together, they're standing next to each other on a production line. So it had a lot of manufacturers scrambling to put devices in place to be able to separate people or social distance them with a barrier, because they weren't able to socially distance them just by nature of their workstation or what they were doing. Distribution, somewhat similar, and interesting challenges and pressures are around getting 300 workers into a building and taking every single person's temperature, and then having a secondary scanning area for people that test high and certain things. So there's been a lot of pivoting and gyrations that have had to take place just in getting the work out the door. And there's been interruptions to productivity and just simply getting people in the building safely and doing certain things throughout the day. And for some businesses that have had a very aggressive change in their demand because of the pandemic, whether that be people that are making PPE, food, certain types of distribution that have just gotten bombed, e-commerce in general, as everybody has come out of the stores into their computers and spending money that they've been either making because they're still employed or because they've been the beneficiary of some of the government support. E-commerce has been incredibly busy through this entire process. So not only learning the new landscape, but also having to do it as demand goes up significantly.
Thanks, Mick. And I also wanted to ask you specifically, like, how have you had to pivot your actual your manufacturing company? Because I know you pivoted a little bit.
Yes, indeed. We've gotten into some different areas of manufacturing, and we've started manufacturing masks and doing things around the PPE space. But then internally, we've had to socially distance our workers. We have what would you consider a cellular manufacturing plant where people are working on different processes. It's not terribly difficult to socially distance them because it's not a production line environment, but we've had to do all different types of things and then assisting our customers to help on their lines as well.
Diana or Signe, you want to speak to that first question?
Sure, yes. So I think it probably is a good moment here to touch on a little bit of the roadmap to kind of recovery on a state standpoint, because a lot what you all mentioned there's a lot of confusion. There has been a lot of confusion. What should the companies do? How do I access the proper and enough the volumes of the PPE that's required? And you know, some of you have been in business from day one during the pandemic and never closed, but some are reopening. We're in phase 2, but it continues. So just wanted to mention on the PPE supply side, Commerce Department did partner with the Maryland Manufacturing Extension Partnership, MEP, where we launched a PPE supplier network, and not only to connect the vendors with the state procurement office or the state needs, but really for the businesses to be able to prepare for reopening in a safe manner. And that portal has been quite successful when these connections have been made, and I'm happy to share that link with you later, Tracy, so you can pass it along if that's of interest. But a little bit regarding the roadmap to recovery. You know, we all realize that you know, it's not going to be a simple process. It's going to be in stages, and various businesses in different industries have very different needs and risks they have to mitigate. So we did engage a lot of businesses and stakeholders from various industries early on in May or even end of April, and formed these advisory panels, 13 advisory panels, just to hear from the business community to understand, well, what are the biggest hurdles? What do they need to prepare? You know, and again, I can go into more detail later about different stages, what that meant in order to, you know, again, for the businesses to open safely, but there are good guidance documents online available for various industries, from retail to small businesses to manufacturing to transportation and even arts. So if you're more interested in hearing and reading about those discussions that we have had with industry representatives and the conclusions and recommendations for best practices, and encourage you to visit the Back to Business website, which is the open.maryland.gov/back-to-business, and it's available there as a resource to guide you as an individual business as you reopen.
I encourage you, Signe, to put any of that in the chat as well for all the attendees and panelists as a great resource for them. So thank you.
Mm-hmm.
Diana?
Yeah, I can jump in now. So at Humanim, as I mentioned, we are a very diverse organization. So some of our programs have been severely impacted by COVID, while others have seen very little impact. And I'll just give some examples. So in our behavioral health department, most of our programs are focused on residential services. And those have basically operated at pretty much full capacity for the entirety of the basically state being shut down. You know, we continue to provide quality services to the clients, but the quality of the life of the individuals was really impacted because of the restrictions to remain at home. And these are individuals who suffer from severe mental disabilities. So has increased really their kind of situations, and they experienced a lot of isolation and loneliness. So our team has worked very closely with the clients. On the other side, on the developmental disability division, we serve over 200 individuals on a daily basis through facility-based and community-based programs. And essentially, as you know, all the social distancing restrictions and the community being shut down, all those programs were completely shut down and are still closed right now. We're kind of slowly trying to figure out how we're going to reopen. We're just going to start with 5 clients in the building next week, and we'll continue to add and just kind of continue to practice social distancing and try to bring staff back to work, and also clients back into the buildings. So we also operate a culinary social enterprise, City Seeds, which before the pandemic was really focused on high-end catering and wholesale, but basically we lost all contracts overnight when COVID hit. So we had to really pivot to continue to stay in business. So we moved from kind of catering and wholesale to high volume food production and delivery of meals and food boxes to individuals and communities experiencing food insecurity. So over the past almost 3 months, we've served over 75,000 meals. So we've partnered with Baltimore City Public School public schools to provide meals to the students because the schools are closed. We also provided lots of meals to individuals experiencing homelessness in Howard County, first responders, healthcare professionals, and right now we're still continuing to kind of operate a high volume food production versus catering, and we'll probably switch when things get back to normal, but right now we're continuing to provide food to individuals experiencing food insecurities.
Thank you. I think the other thing that I'm curious about, and some of the questions in the chat have alluded to this a little bit, you know, our second question about what does the future look like? What does our workforce look like in your industry? If you had a, you know, magic ball of what we can look for in the future, as far as you can tell, what do you see think it's going to look like? And I think also at the same time thinking about equity and how that thread is continually running through our minds at HCAM, but also across the country related to equity and inclusion, and how do you view the future of the workforce in your industry? What does that lens look like?
I can start if you like.
Okay, great, Mick, thanks.
Well, I do believe that events like this don't necessarily change the course, but accelerate them in any number of ways. I mean, we were messing around with the world of digital like we are now with Zoom and different things, and now it's become completely integrated into our business, and that won't change. And I think the movement towards automation in manufacturing and distribution, which was already started, I do believe that's going to get a significant injection in speed as well. And not exclusively because of the virus and the idea that machines don't get sick. It's not necessarily about that. I think that a lot of things we were exposed in any number of ways in the amount of product that we don't make here in the United States anymore, and how reliant we are on other countries for so many critical supplies and other things like that. So it's a great time because automation has never been more affordable. The cost curves are bending on automation. There are new technologies that are allowing us to do more in manufacturing and distribution. And I think manufacturing is you know, people have seen robotics and have seen things along the way, but the area where most people are is what's happening in the distribution world and the benefits it'll have to the United States. I'm here in California because we have 2 teams deployed bringing completely robotic and semi-autonomous warehouses to life for Adidas and the retailer H&M. And this should give, if we do it correctly, it should give the United States the ability to start to compete globally in industries where we haven't been able to compete before. So by bending the cost curve and improving productivity, you now are able to produce things here in the United States profitably that you might not have been able to in the past. So the idea, and then tying that into healthcare, if we can bring that work back here because we can do it cost effectively, we should be able to grow the United States pie on the globe more and make better and more investments into healthcare and the individuals that, you know, will need to be able to keep up with the demand. You know, we're the biggest customer on the planet. It's not even close. So if we can start to get the technology in line, then we should have more jobs for people and more money to reinvest back into healthcare and deliver a better quality system.
More jobs, hopefully, right? As
Yes,
well.
absolutely.
Yeah.
More jobs. Yes, that's, can I just like the kind of, I love that kind of, the idea is more jobs, right? I mean, everyone is very concerned and sometimes necessarily, but a lot of times not necessarily about machines taking humans' jobs. It's not that. It's more times than not when we are delivering automation, we're improving productivity, we're improving profitability, and the ability for the entire company to stay in a particular area, their state, or in the United States. So that productivity is incredibly valuable, and it contributes to all of a company staying in business and all of those jobs staying in the United States. And then put on top of that the ability to reshore or onshore other types of products that aren't able to be made here right now. The benefit should be exponential if we execute it correctly.
Yeah.
I think you muted yourself, Tracy, by mistake.
I did mute myself, and now I have to pay $5. That's what we always say. $5 in the tip jar. So Bob, if you're there, thoughts on what the future will look for in the restaurant industry? That would be really interesting perspective as well, if you had a magic ball.
Can you hear me?
Yeah, we can.
Yeah, I think that I'll give some back to Mick on that. As far as technology is going to be a major role in the restaurant industry, I think the restaurant industry is caught between a tanking economy right now and a workforce that will need reliable healthcare coverage. I think that's over the past years, that's not been the case. Most people that worked in the restaurant industry really didn't get healthcare coverage. They were in for a part-time. It was something that they started their careers in. But now I think more than ever, there's going to be those team members are going to look for employers that offer healthcare coverage, or that they're going to offer some type of reimbursement. So I think to attract top level team members going forward in the restaurant space, they're going to have to at least compete in providing some type of healthcare coverage. I think in addition to going forward, it's going to be interesting to see what team members and how they feel coming back into work, wearing masks, gloves, learning the new standards, policies, and procedures. I'm not saying it won't happen, but it will be a challenge to increase the training and development of those people, along with what costs can the restaurant industry absorb, not only in the training and development, but those healthcare coverage. The restaurant industry is very tight when it comes to margins. So adding that healthcare coverage and adding that the additional training procedures, it'll be interesting to see how restaurant companies, especially independents, fare during this whole process.
Yeah, we're starting to, I'm already starting to see that shift of, my favorite restaurants are not reopening, and ones that have been around for a really long time in the region are not reopening. The gift certificates are sitting there being unable to be used, and it's disappointing and sad. I'm curious, Signe, how commerce is looking at the future of workforce.
Yes. Yeah. And we're kind of looking at again on a broader kind of trends and across the industries. What are we hearing? And it seems as the key word really is the flexibility, right, across the board. A lot of us who were able to remotely work from home, they would probably prefer to continue in some form of fashion, even if it's a part-time or whatnot. Some still obviously would like the in-person connections and meetings and whatnot. So it's really from the employer standpoint, as flexibility is probably going to be the key or the new norm, whatever that is, really. But the corporate offices, they will look and feel very differently, right? I mean, some of the things that happened during the pandemic will have a long-term impact. We're going to have to change our daily lives, whatever we do, how we do grocery shopping, how we go to work. You're going to probably continue having these temperature checks and requirements for PPE for the, unforeseeable future until some medical breakthroughs are made in terms of vaccines and treatment. So it's going to impact all of us in a very, very different way. But I wanted to touch on the technology side earlier. I mean, that probably has been one of the biggest challenges so far is how do you ensure that your workers have the ones that can actually work from home, that they have the necessary internet connection. I mean, not all of us, just from our commerce standpoint, when we all went to work remotely early March, well, probably 1/4 of our workforce was not equipped. They didn't have the laptops. They didn't have the, Wi-Fi access. So it took a while to get them up to speed. So the technology will be, really crucial part for remote work that is going to be, and high-speed internet, not just internet, the one that doesn't freeze you, right? But joking aside, from the educational standpoint, though, e-learning obviously has been a very trending for a long time already opportunity for to upskill and bright skill your skills and improve your performance and productivity. So that probably is going to continue. And you're probably going to see more even internal trainings to be moving on different types of e-platform educational systems. So yeah, I guess those are a few points that we kind of hear and see what the industry is talking about and seeing.
Diana, any comment on that?
I mean, I kind of echo what Sig has said, and I'm sure, I know we have a lot of participants from the nonprofit world, and I'm sure everybody's in the same boat as nonprofits. You know, there are very few kind of laptops around the organization. So when it came time to remote work, you know, a few folks are able to do that, but not a lot. And you know, as my role in fundraising has really been on focusing on raising the funds to be able to purchase technology so our staff can actually work remotely, because otherwise they can't do any work. And, you know, when they couldn't come into the building, that was really an issue. Yeah, technology, e-learning, but also just kind of from us, for us at Humanim, I mean, we do a lot of workforce development training programs, and we're looking now at what opportunities are out there in terms of, you know, what do employers want now if there's a second or third COVID wave? You know, what skills do they need from their new employees? So we're trying to figure that out so we can equip individuals who have barriers to employment with the skills that are needed in today's work environment. You know, the ability to use Teams and Trello and Zoom and everything else that's out there that everybody's using to be able to do work from home.
Yeah, it's a question that has come up with HCAM, where, you know, have over 200 employees, and March 13th was our last day in the office, and we went completely telework and had a big push to outfit over 86 staff with laptops. You know, again, it speaks for my mind as a CEO, from the equity issue of access to high-speed internet, as Sig had talked about, and making sure that they have all the things that they need to do their job if we're staying in a telework status. And some of the work that we do is face-to-face, and how does that shift as well for us? And obviously in the restaurant industry, it is all about the customer and face-to-face and meals. So
yeah, Tracy, can I just add one thing also? Obviously, yeah. It's more so in a office setting, or people who, you know, usually would sit behind their desks. I think just from our own experience, in addition to access to the technology, a lot of people didn't even have a designated space at home. They don't have the desk, they don't have the chairs. Like, we probably have half of our staff having to go to see a chiropractor after this. And I'm not kidding, me one of them, because you sit in one position, you know, 10, 12 hours a day without the proper really office furniture, or some don't even have a designated space. They sit on their couches, right, with their laptops. So that's another thing is, you know, it seems so minor, but it is, it can really have a big impact on, you know, folks' kind of health, general health as well. So.
Well, and I also think the mental health piece, you know, my next question is, how will healthcare for employees be impacted? For us, we're starting to look at not only the physical health, but the mental health. And, you know, we've looked at that for a long time. You know, there are many introverts in the world that are super happy to work from home and not really having to engage with their cubicle mates. And the extroverts are just jonesing to get out. And I think, you know, we need to identify new ways in the mental health space to ensure that our team members are okay. So I'm curious also how healthcare for employees will be impacted. You know, Bobby referenced actually having to look at purchasing health insurance for those in the restaurant industry where it hasn't been part of the plan historically.
Yeah, I think that, I mean, you just hit the healthcare. I don't think, as I stated, most restaurant workers never really thought about healthcare, but it is definitely front of their mind right now. But you talk about mental health issues. I mean, that's a big concern for the restaurant industry right now, because most restaurant workers are living check to check. and especially the tipped servers, the bartenders, they're living off those. Well, for the last 90 days, they didn't have that. Yes, they had unemployment, but I think everybody on this, a lot of people on this phone worked in the restaurant industry at one point in time, maybe through college or high school. You understand that most of those tips may not get declared 100%. Not that they're what they're supposed to, but so that what they were earning and what they were earning on unemployment are two different things. And so I think that's one big thing, the mental health, and then them looking for healthcare coverage for the first time. They understand how important it is. I think the other piece, as you're talking about the impact, I think that the new cleanliness and sanitation and sterilization is going to be huge, big expectations for staff as customers as well. But I think the combining of that and the technology, we talked about technology many, many times, technology is going to come to play. So you're going to have to get everybody to adapt to that. That's less touch points along the way. Mobile applications, mobile menus, other applications, prompt pay, all those things are going to be important. And then, as you know, I'm sure people are on this phone, and then I'll kind of let go. You know, there's a lot of mobile applications out there now tracking employees' behavior and how they're going, how they're coming to work, self-reporting health information. It's never before in the past. And you know, a lot of times in the past, somebody, you know, were nervous about calling in sick. Well, that's going to change the impact of how people manage the restaurant space, because in the past, you know, it's like they expected everybody to come to work. Well, now we're telling people, if you're not feeling well, don't come to work. So that's a whole new learning curve as well, and how it's going to impact not only the employees but the space in general in our industry. And that tracking and having self-reporting and evaluation, it's going to be interesting to see, because you know there's a fine line when it comes to laws and how you're going to handle that. But I would think those three things are the biggest things that I see a big difference in the impact of our industry.
Diana, I saw you agreeing with Bob. Thoughts on, I know for me, just going through a drive-through, every time I go, the technology has shifted completely, whether it's a person standing out there or taking my order, or actually, you know, the credit card holder is actually, this morning was put out on a long pole for me to put my credit card in, so that they didn't have to even touch my credit card. So thoughts on that in the workforce space for Humanim?
Yeah, so yeah, employee wellness, I think, and self-care is needed now more than ever. You know, I think folks learning new skills, that can be very stressful if they're not comfortable with technology or what other new tools that they have to learn to do their jobs. So, and that can really wear down on people's mental health. You know, I think some of us are, you know, very lucky that we're able to work from home, but there are individuals, the direct care staff, who don't have that option. Those individuals working in residential settings, hospitals, or other facilities, they're truly putting themselves at risk every single day because of their jobs. So sometimes for them, it's even pretty much impossible to maintain social distancing when working with, you know, a client or a patient. You know, obviously everybody's wearing PPEs and masks and gowns, but they're still, you know, at risk. And there's so many new rules and guidelines that have to be followed now when it comes to safety and healthcare. I mean, we have meetings at Humanim on a weekly basis trying to figure out kind of the health and the safety protocols as we're reopening. What should clients do? What should staff do? And it's a continuous conversation, and it varies by department. It's not a one solution that's going to fit everyone. So it's going to take a little bit of time to kind of figure it out, and I think we're all going through it at the same time.
Yeah, it's a really good point, Diana, that it isn't a one-size-fits-all, that you really are going to have to look at the healthcare for the employees individually, depending on their specific job, how forward-facing they are to the consumer, and we're dealing with the same thing as our staff go back into the prison, but the other staff are working from home and teleworking, so we're dealing with many of the same challenges about reopening and when do we start to reopen. But been in that planning stage for a long time, and thinking about all those different healthcare issues related to whether it's physical health or mental health. And Signe, I know that there was a task force on many of the industries that address these questions. Did healthcare and mental health come up in these conversations at all?
Yeah, yes, I mean, they certainly were part of the discussion, but in terms of the guidelines that were put forward for best practice for businesses, I think it is, as we all hear, it's not a simple task. You can't really have a guideline how to deal with it, because it is, one thing is you have a job. It's just these people can be in the same mental stage as the ones that don't have, so it is a very across the board kind of a challenge, but it's certainly something that needs to be focused on internally on every employer side, because it is probably going to be inclining rapidly, as we have seen. So
yeah. Whoops, sorry about that. What additional training do workers need to access to be relevant in the new economy? Right, so as we see the millions of people that have hit unemployment and trying to look at transferable skills, what training programs do we need to continue to have out in the community for people to access to be relevant to the economy, to transition from that restaurant worker to X position?
I mean, I could start, Tracy, if you like.
Sure, Mick.
Yeah, so in manufacturing, I mean, there's a huge opportunity to return to some of the older skills that have just gone out of the workforce. If you look at the trades type, the welders, the machinists, the types of people that are critical to manufacturing plants, the United States still is very strong in aerospace, for example. So, the ability to weld aluminum, for example, is incredibly important and pays very well. So as the later generations have come through most recently, we've lost some of that tradesman activity, and therefore there's a huge gap in the manufacturing world for machinists and welders and people along those lines. Now, those machines are becoming more automated too, and they do have onboard computers, whether it be PLCs or they're connected to the internet because they're pushing data out about processing times and productivity. But there's a heck of a opening to go back and refill some of those critical jobs that have been left behind that are still in high demand, still pay incredibly well. And a lot of them were right here in Baltimore, with whether it was Bethlehem Steel and Bethlehem Ship and those types of jobs, especially because we do have a pretty strong aerospace economy, whether it be supporting Northrop Grumman or General Electric or some of the locals. There's some of that's available. I mean, it's not exclusively going to be about someone who's a little bit older in the workforce learning how to write code. Will there be aspects of their job? Yes. For example, everyone on our manufacturing floor has an iPad that they are plugging data into throughout their day. It's tracking labor productivity and giving us details back so we can manage more effectively. But at the same time, those user interfaces are getting easier to use. They're getting more intuitive. You have cell phones now in the majority of Americans' hands, and it's relatable in a lot of ways. Your iOS or your Android or a lot of these operating systems and platforms have a similar look in the manufacturing world. It's not where you're speaking Spanish over here and you're speaking Italian over there, and you have no idea. There's a lot of similarities, and as all ages of the workforce are in and around these tools in a daily activities, whether it's ordering on the McDonald's menu board that somebody mentioned and things like that, the manufacturing and distribution world, their interfaces are similar. So yes, there is going to be some training that needs to take place, but I think it's going to need to be combined with an equal amount of open-mindedness and the ability to give it a shot and to be committed to learning some new tricks.
Bob, I think you also had some comments on that.
Yeah, I think, what Mick just said. I mean, there's a lot of things as far as, you asked what additional training, you kind of hit it. Mick was just saying about it. I mean, in the past, technology was very slow in the restaurant space. I use it all the time. 10 years ago, we were still doing things. There were a lot of restaurants still putting orders on paper. It's going to be a lightning speed now to get technology into the space, again, for those touch points. The other thing is the really training. Yes, we always wanted to teach serve safe and all the things that were important and have a healthy environment. But now, and I know we were not talking about the guidelines, Tracy, about CDC, but all employees. Yeah, no, I got you. I was just kidding. But all employees are responsible now to provide a safe and healthy workplace. So, besides training, the menu knowledge, steps of service, brand development, all those things, companies they are going to have to dedicate someone to have this understanding to teach the employees of providing a safe, healthy environment for their coworkers and for their staff. Because as you stated, you cannot be in the restaurant industry and work from home. It doesn't work. But the restaurant industry, I will say, is changing, and you're going to see a lot more. I mean, people are creatures of habit, and you've seen a lot of curbside. We've seen a lot of pickup. We've seen a lot of delivery. That's going to continue. So we're going to have to train our team members how to embrace change. That's going to be a whole new thing as well. Back to your mental health. We can't continue to do the same thing we've done for the past years. It's going to change, and you're going to have to embrace that change, and you're going to have to learn new trades within your industry.
Yeah, it's a challenge. Change is hard for so many, and we've been going through this pivotal change. And again, I've been hearing in most of my Zoom calls that, we need to embrace the technology in which we have been utilizing and move it forward. And this is a great opportunity to move it forward, to utilize technology in our businesses. Signe, additional training that the department, I know DLLR, we've been having conversations with them as well related to workforce development. But I didn't know if Department of Commerce had thoughts on the training aspect.
Yeah, I mean, in terms of our programs, we do have a partnership with Workforce Quality program that will help the businesses to retool and help the employees to maybe pivot from whatever they were used to doing before to perhaps learning a new machinery or being more productive or whatnot. So there is some funding available from our department for sure for that purposes. But, what Mick and Bob were saying earlier, it all is, again, the technology ties it all together. But I think another opportunity really for folks that are out there is to think about the delivery of services, how it has been changing during this COVID time, not just, you going to a grocery store, which slowly started before. You could do Instacarts and whatnot, but now, a lot of people were using services for that. Your healthcare, your telehealth appointments. I mean, that's probably going to be the next wave of, first of all, obviously you can serve more clients. It's more cost effective. That's probably going to be a trend where we're going to see continuing after this pandemic as well. But generally, as delivering services, how is that done? How did we change that during this time, and how is it going to move forward? You're on mute, Tracy.
I'm always on mute. Now that's $10. Sorry. Our navigator team that helps people enroll in health insurance, a week into the pandemic, they were allowed to enroll individuals in health insurance over the phone, which as part of the law, we're not able to do. And so that changed a week into the pandemic, and it is our hope that it stays that way. Only time will tell if that policy stays in place long term. We can enroll people. People don't have to leave their home. They don't have to come down and take 4 buses to try and get to us. So we see that, access to health insurance coverage, we're hoping will be quicker because people can just call us and enroll over the phone for health insurance. But of course, only time will tell, and our hope is that we don't go backwards with the technology. Diana, did you have any words on training from a workforce development nonprofit? It's probably what you think about all day long.
Yeah, and I mean, it's very similar to what I think everyone has mentioned. I mean, we're looking right now, moving some of our programs that we would have 100 people in the building at one time every day to these virtual classrooms. So our staff are working right now on creating virtual curriculums and working with the clients and providing services that way versus going and picking up, you know, these folks from their house every day and bringing them to the facility to do community-based programming. And now those services are changing to more kind of virtual classrooms, you know, daily check-ins, but it really changes the way that we provide services. You know, transportation could be completely eliminated because we don't have to go and pick up hundreds of clients every day from their houses. And that's, you know, a program that it was employing a lot of individuals that could disappear, or it could be cut in half depending on how things go. And the same thing kind of on the workforce development side, you know, as Sig mentioned, these are going to be cost efficient opportunities for some organizations to move from traditional kind of workforce development to virtual programming.
Yeah, the real estate industry is the hard one to be in right now, especially for commercial real estate, as the buildings, most of them and many of them lay empty and people are rethinking their leases and so forth. So I know that that's going to be a challenge as well.
And I'll add like another thing that we've kind of been experiencing over the past couple of weeks, just kind of bringing people back, but also hiring new people. I mean, we're doing the interviews via Zoom. I mean, we've hired so many people in the past couple of weeks, but it's all basically been done virtually. It's the same thing with the onboarding and the training of individuals. So we're kind of taking that piece out completely and moving to virtual hiring and training of individuals, which is totally different. I'm a people person, so I like to talk to people and see them, not through a computer. So I'm going through that right now, and I'm like, not my favorite thing.
Yeah, absolutely. And we're doing the same thing. We yesterday just onboarded 4 or 5 new staff. And so it's weird for me to go and talk to a group of new employees at HCAM as the CEO and try and get to know them. And I'm also a people person, so it is strange for me. And not everybody interviews well on a computer screen. It's awkward. And so again, it's another transferable skill from, you know, instead of writing your resume, it's how to do an interview on a Zoom call. So I think those are some other things from a training perspective we'll have to start to look at. I wanted to just open it up in the last few minutes to anyone that had any questions for our panelists. I'll give people a second to just type in the chat if anybody had a specific question that because we do have a few more minutes. And I think it was a really robust discussion for people. I've learned a lot, especially around just all the things that we need to start to think about in going into businesses, having conversation. For me, I'm trying to show a little grace when, you know, you're starting to go into those businesses and they might not have it quite perfect yet. Trader Joe's seems to have gotten it down pat, but I think some of the other businesses are, you know, it takes a little bit longer from a corporate perspective. So to try and have grace with people as they're trying to get their businesses back up on their feet. So I don't see, somebody had a question on retraining. Do you see broader systemic changes starting to happen in education and the perception of VOTEC training to not only retrain the existing workforce, but also align the up and coming generation with these future changes in manufacturing? This writer's sense is that the U.S. always pushed college at all costs, which hurts future manufacturing. So I think it goes back to some of the questions that Mick was referencing, or comments Mick was referencing about those jobs. So.
Yep. I can now, yeah, absolutely. So the answer is no, there's still a tremendous disconnect between the education system and at least the manufacturing world. It's starting to get a little better or move in that direction. And there is this conversation that I do have on a fair occasion about college, for example, and is it right for everybody? And does it always, yield the results that everybody thinks about. But I do get the benefit of traveling to a lot of different schools. We spend a lot of time in schools. My favorite are the middle schools, the 6th, 7th, and 8th grade, especially the ones that have a STEM slant to them already, where they would advertise them as a STEM school. And what I see the most is the teachers are just as in awe as the students at the technologies that we're bringing in. So there's a disconnect there for the teachers in a lot of those situations as to what this STEM training or what this STEM school or what these children at 6th, 7th, and 8th grade are going to actually do with it. You know, they use different software like Alice and Python and certain things like that. But I'm not sure that the connection is always being made. You know, we bring in one of our collaborative robots and let kids play on it and program, and their eyes light up. But I don't know that the connection there to saying you're learning how to maneuver this ball through this area using coding and using RF technology and things like that, because this is what the next step looks like. And I think there's missing some of the excitement in there to connect all the dots to say, wow, I could actually be working on programming equipment that looks like this and does things like this. So there's still quite a disconnect in getting the teachers educated so that they can deliver the curriculum in the appropriate way to the students so they can get as excited as they should be.
Great. Thanks, Mick. Yeah, that's a challenge and frustrating, and much, I think we have a lot further to go in bringing the school systems back up in alignment with where we're headed in the workforce. We have just 5 minutes left, and before I run out of time, I wanted to thank everyone on the panel, Diana, Sig, Bob, for their thought-provoking comments. I would like to hear from those in the audience, participants. What's your big takeaway from today's discussion? We want to make sure that your hour was well spent, and I love your feedback on what is your big takeaway from today's discussion. You can just put that in the chat. We would love to see it. And again, I wanted to thank everybody for joining us, and SCNH for their sponsorship today. We appreciate that. We'll be coming out with another speaker series slated for September. So keep an eye out for that one on the topic, and maybe it'll be in person, but I'm not hopeful. Any other last words from the panelists?
No, thank
Sure,
you.
I'll just really quick. I think we should think about, you know, before COVID-19 hit, employees were looking for leadership, stock options, great workspace, happy hours, wellness programs. You know, just keep in mind that that's shifted now. Now they're looking for work from home, desk protection, working shifts, trust within the employee. So we have a big shift in the last 90 days. So as you're looking at your business, look at it differently than you did 90 days ago, because what employees are looking for is much different today than it was yesterday.
That is absolutely true.
And thanks, Bob, for that. I also just wanted to add, it's interesting that given what we have been going through now, having to do video calls and seeing your employees, you know, in their home environment, you kind of have broken kind of the official, you know, wearing your suits to work. Now you're seeing everyone in the relaxed home setting. You know, it kind of builds on also, I think, on a relationship building and bringing down some of the walls, and maybe going back, we're not going to wear suits anymore. Maybe we'll just be more relaxed. Maybe that's another, that could be the benefit of this.
Yeah. and having your children back and forth.
Right. But thank you all.
Thank you, Sig.
Yeah, I think the other thing that I would mention, and I think it's for, you know, employers and employees, is, you know, being flexible, but also adaptable too. I think that's something that is, you know, it has come out of kind of this pandemic over the past 90 days on both fronts, the employers and the employees.
There's lots of comments in the chat, and I think one person said we don't have all the answers, and and we're working at it, and I think that's a really good one. From the CEO to the frontline staff, we don't have all the answers, and everything is constantly changing, and to be patient, but also to have grace in that it is very challenging for the front line staff to the CEO who's trying to balance and manage working from home and school and learning math all over again because you're trying to teach your kid math. So these are all really great points, and I hope it was an educational hour for everybody. So thank you all for joining us. I appreciate your time.
Alrighty.
Thanks, Tracy.
Thank
Thanks.
you.
Everyone.
Thanks, everyone.
Thanks, everybody.